I'm Morgan. I'm going to be your student nurse today.
Okay.
Did you come in with any pain?
No.
Okay. Can you tell me your name and date of birth?
Lauren Lee Burton, 053098.
Okay. Patient looks light brownish tan in color, looks alert, communicable, looks dated age. Okay, today I'm going to be doing a skin, hair, and nail exam on you. So I'm just going to be looking at your hair, feeling your skin, and looking at your nails. Is that okay with you?
Yeah.
Okay. And have you been experiencing any excessive bruising at all?
No.
Okay. Right, I'm just gonna start by looking. Get that too. Okay. Okay, patient is overall light brown pigmentation, and skin seems to be intact. Okay, feel your sound. Okay, arms were warm, dry, and smooth. Okay, feet and legs were also warm, dry, and smooth as well. Now we feel for edema. 1, 2, 3, 4, 5. Okay, edema was 0 on a scale of 0 to 4. Okay, now I'm gonna pinch right under your clavicle here. Okay, skin recoiled very quickly and went back to its original position fast. Okay, I'm gonna do capillary refill. Okay, capillary refill was less than 2 seconds bilaterally. Okay, I'm just gonna look at your nails now. Okay, nails are smooth, nail beds are pink in color, well-rounded. Okay, now I'm going to look at your hair. If you could just turn this way a little bit for me. Okay, hair seems to be a curlyish, wavy kind of texture. It's full and even, and I don't see any moles, bumps, or lice present. Okay, do you have any moles that you're concerned about at all?
I have one on my back in the middle.
Okay.
That's kind of bigger.
Okay, the mole looks to be asymmetric. There is an irregular border. The color varies a little bit. There's dark brown and light brown present. Diameter is less than 6 centimeters. It is not elevated, and has it been changing at all recently?
No.
Okay, and it is not funny looking. Okay, I think that is it. Do you have any questions for me?
No.
Okay, thank you.
Chance. Okay, I'll knock on my patient's door. He'll let me enter. I'll introduce myself. Good morning, my name is Claudia. I'm gonna be your nurse today. And we're going to be going over our hair, skin, and nails assessment. So first I'm gonna start off by asking 2 questions. My first question, have you noticed any changes in your moles, any changes in size, shape, or color?
No.
Okay, next question. Have you noticed any recent excessive dryness or itching on your skin?
No.
No, okay. So the next portion of our assessment, we're gonna be just inspecting and palpating the skin. So I'm just gonna start off by looking at the color of our face, chest, arms, and legs. I wanna make sure that there is no pallor, which is paleness. I want to make sure that there is no erythema, which is redness, no jaundice, which is yellow, like yellowing of the skin, or any signs of cyanosis, which is blue. But it looks like our patient's skin is nice and pink. And while I'm here, I also want to check the temperature. So I'm going to be checking the temperature with the back of my hands. And I'm going to be checking upper and lower extremities and making sure that the temperature is nice and equal, and temperature is nice and warm. Then I'm looking at the texture of the skin, which is smooth, and the skin is nice and thin, which is normal. I'm also noting that there's no edema in the upper extremities or the lower extremities. And I also want to check the mobility and turgor on the chest. So how we do that, we're just going to pinch the skin right here. And we want to make sure that the skin rises normally without any difficulty, which is the mobility. And the turgor is making sure that the skin goes back down with no tenting. So that's good. Lastly, I want to take a look at any lesions or abnormal markings on our upper and lower portions of our skin. So I see here that the patient has freckles or macula on his anterior and posterior shoulders here, and these are flat and light brown to the color. We also see very few moles or papules. They're all less than 6 millimeters in diameter, and all light brown to the color. No other lesions or abnormal markings on the top portion. Now we're going down to legs, and I don't see any freckles or lesions or other moles, but I do notice that there is a new little lesion above the right kneecap. It isn't elevated, it isn't draining, and it doesn't seem inflamed. So it looks like it's healing nicely. How did you get this little lesion?
I got it at work. Nail hit me.
Okay, well, it looks like you're doing a good job cleaning that, so just continue doing that. It looks like it's healing nicely. After that, I just want to take a look at your back also and note the same thing. So we're looking for any lesions or abnormal markings. Again, there is a lot of moles on the posterior side. There are flat macules, again, light brown to the color. So we're done with this part. After that, we are going to go over our hair inspection. So just by looking at it, our hair is ashy blonde. Our texture is smooth and thick. The hair distribution is nice and symmetrical, and while I'm parting the hair here, I'm looking for any lesions or infestations, but my patient's hair and scalp is clean and dry. So after that, I want to go over our nails. So we're gonna be looking at our upper extremity nails here. We wanna make sure that the color is pink on all 10 nails. Here we can also check capillary refill on all 10 nails. And we're just looking for that blood to come back and making sure that it's less than 2 seconds on all 10 fingers, which it is. After that, we can check the consistency of our nails, which they should all be nice and firm and no sponginess. And then after that, we want to make sure that our nail profile here, put your nail like this, that our nail profile is less than 160 degrees and our nail shape is nice and flat. So after our upper extremity nails, we want to go down to our lower extremity nails. And here, same thing, I'm noting the color, which is pink on all 10 nails. We can do cap refill on all 10 fingers, which should be less than 2 seconds, so blood return is good. After that, we can also check the consistency, which is nice and firm. We're also checking the nail shape. Down here, they're slightly a little bit more rounded, but that's normal. And our nail profile here is less than 160 degrees.
Hi,
Talia. It's nice to see you again.
You too.
How's your summer going?
It is good.
Good. Today we're just going to do an assessment of your skin, your hair, and your nails. Just looking for any abnormalities.
Okay.
Is there any concerns or issues you're having with your skin?
Um,
Dry skin. You look like you've spent a lot of time in the sun. Do you use SPF?
yep, I'm about 50 or higher.
Okay, and do you reapply it frequently?
Yeah, every few hours.
Okay, good. All right, so let's take a look at your arms. I see a few birthmarks. It is important to keep an eye on these just to check to see if they change shape or color or they become itchy. Because at that point we'd want to have them evaluated by dermatology.
Okay.
Okay. Can you just see your legs, please?
Mm-hmm.
Any issues with bruising or anything like that?
Just bruising sometimes. If I
Okay.
take a hit.
Okay. So it's important to always to make sure you put sunscreen in between your toes because you can get carcinomas. That's a cancer in between. Can I see your other foot too, please? Thank you. In between. Okay, so that looks all good. Okay, good color. Okay. And I just want to take a look at your back. Sometimes it's hard for you to, if you could just turn this way, please. It's important to either have someone look at your back or to use a mirror to see. Because sometimes with sunblock you can't always reach all of the areas. Okay. Nothing here. Let's just check this side. Okay. And just want to take a look at your mouth, your eyes, and I'm just looking to see, you know, that they're pink. They should be pink. Your lips look nice and moist. Nice, moist, pink tongue and mouth. Now I just want to check your hair. Do you have any issues with your hair?
No.
Dryness?
Some dandruff sometimes.
Dandruff sometimes. Okay. And what type of you use dandruff shampoo?
Head and shoulders.
Okay. Very good. You have a nice head of hair here.
Thank you.
Okay. Let me just see your nails look nice and pink with a nice good cap refill. Okay, so I think everything's fine. Is there any questions, concerns that you may have right now?
No, not at the moment.
Okay, are you seen or followed up by dermatology at all? Do you do like a 2-year checkup or anything with them?
I have been, but I haven't been in a little while.
Okay, so maybe now might be the time, summer's here, to go and just be checked out again just to make sure. Okay, well, it was a pleasure meeting you.
Again.
Thank you.